Alright, shoulder pain in the bench press. So, after watching this video, as I'm sure you would have noted by now, that shoulder pain in the bench press can be kind of a big pain in the ass. So today, we're going to talk about 5 variables that we can manipulate to try to fix that pain, and ultimately that will lead to increased stability and then over time much greater performance. So, first variable is grip width, which will obviously pertain to where your hands are connected to the bar at. After that, there's touch point, which will be referencing where exactly on your body the bar is going to touch when you're descending. Next is scapular positioning, which will obviously have all to do with your scapular actions, elevation, depression, protraction versus retraction, where those all are at in space when you're bench pressing. Bar path, which is obviously referencing exactly where the bar is moving from point A to point B, point A to point B, on the way down and the way up. And then the last variable that we can manipulate is incline, which will obviously be how your torso is inclined, usually by way of a bench. All right, the first variable we're going to talk about is grip width. So as we mentioned, the grip width is just referring to where your hands are connected to the bar at. When I'm coaching the bench press, what I'm usually looking for is what's called joint stacking. So that would be, so at the bottom of the lift, the wrist is going to be right over the elbow, and the bar is going to be right over the middle of the wrist, right? So at the bottom, the joints would be stacked, right? The joints are stacked on top of each other. That will for sure vary from individual to individual, but it will usually result in the best force production capabilities when our joints are stacked right over each other. If we're too narrow, again, wrists inside the elbows on our way down, that can, I mean, it's more tricep dominant, which is a great movement, but like if you're trying to produce the most force and lift the most weight possible, it is not optimal. And then obviously if we're too wide, as we come down, I'm exaggerating a little bit, but as we come down, if we're too wide, we get into increasingly precarious positions for our shoulder joint, shoulder girdle, and can put a lot of iffy tension on the pec muscles. There is an optimal range when we're talking about joint stacking, so there isn't just like a binary, you're in perfect position or you're not. It will usually be a range. However, in that range, the wrist will be largely right over the elbow joint, right? So again, a little in, a little out's fine. You can manipulate that as needed to try to accommodate the pain in your shoulder. But for sure, if we're too narrow, we're suboptimal. If we're too wide, we're suboptimal as well. All right, next variable is touch point. So that's obviously referring to exactly where on your body the bar is going to touch on the descent for the bench press. Should be noted this is influenced heavily by your grip width, like we just mentioned, and then individual shoulder mechanics. A general guideline that I use when I'm coaching is that for most individuals, the bar is going to touch towards the base of the sternum, below the nipple line. As we mentioned, influenced by grip. Generally speaking, the wider the grip is, the higher we're going to end up having to touch, and the narrower the grip is, the lower we're going to end up having to touch. Now, when we're talking about injuries and pain in the shoulder joint, this is anecdotal, but I tend to see the most issues in individuals that are either benching super wide and touching very high, again, loading a lot of anterior delt, maybe causing a little bit of shoulder impingement over time, or super narrow, usually with individuals with long arms that are going super narrow, but they come down here like this, and they end up bench pressing like this, where they're getting this forward scapular tilt, which again, a lot of stress on the shoulder joint in those positions. So what I tend to preach, again, if our joints are stacked how they should be, wrist over elbow, bars loaded right over the middle of the hand, we come down towards the base of that sternum. That's a good middle ground between those two. Elbows are slightly tucked, 45-degree angle. Again, as we descend, we come down at a slight angle towards that position, base of the sternum, and then we come up and back, again, over our shoulder joint to complete the lift. The next component we're going to talk about is scapular position. So when we're talking about scapular position, we're basically talking about what our scapula is doing when we're bench pressing, right? It should be noted there's a difference between shoulder action, right, and then shoulder girdle. We're going to be mostly talking about the shoulder girdle. If you're curious about the difference in those actions, I'll link something below that'll kind of give you a more thorough take on those. In the meantime, what we need to be familiar with are 4 actions. There is protraction, retraction, elevation, all right? The ones we're gonna focus on, that we're gonna manipulate are those 4, and we'll talk about that. So, the bench press is kind of a funky movement. There's not a whole lot of, when we think about like movements in the gym, resistance training movements that mimic like things we do in the everyday world, functional, as you may call them. The bench press really doesn't have one of those. It's this weird, there's a board that is essentially jamming our scapula out of position, and we're trying to press something off our chest, and it's just not super common. So, by nature of that, it causes us to have to fight the fact that there's a board trying to jam us out of position. So that's where we want to utilize that retraction and depression. And that's going to do a couple things besides making the shoulder joint and girdle stable, which we're trying to inhibit movement in that shoulder joint when we're bench pressing, or excuse me, that shoulder girdle when we're bench pressing, right? Have that joint be stable. It does decrease ROM, because again, if we're fully protracted here, right, and we bench press right here, besides having obvious issues in the shoulder joint, that's a much bigger range of motion than if we retracted our shoulder joint and then depressed our shoulders, right? That, again, ballparking, cuts my range of motion down from full protraction to full retraction by like 20-30%, right? And then, assuming your grip width and touch point are all in order, that also will allow you to load more of the pec. Again, if we're touching higher, it tends to load more anterior deltoid, which again causes issues over time. So, it should be noted, retraction, protraction, elevation, and depression are not binary. You're not picking one or the other. There is a range. And just like all of these variables are meant to do, you're supposed to manipulate that range to try to find the most optimal position to decrease shoulder pain. All right, the 4th variable we're going to try to manipulate is bar path. So the bar path on the bench press is obviously not a straight line, right? We've already mentioned that. Again, if you're following all the variables up at this point, this, from the over the shoulder joint, where we should be at the start, to here, is not great for your shoulders, all right? When we bench press, we come down at a slight angle, and then we return at a similar angle. On the way up, obviously when we have a good amount of load on the bar, that's in a perfect world, that's just not how it's gonna work, right? So, a couple things to consider with bar path and the bench press. We'll start with the big issue that tends to concern bar path on the bench press. Besides being straight up and down, that's an easy one to fix right away, especially if we're manipulating those other variables, is elbow flare too early. So, this will manifest in the bench press, a bar path, if you're looking at someone from the side, where the bar path would be, and then goes basically straight back over the neck, top of the pecs, right over the shoulder joint, right? That does a couple things. So if we're pressing here, we're down to the base, we do our pause, up, and then our elbows flare and the bar shifts over here. Again, that does things we already know are poor for the shoulder and poor for producing force. Anterior deltoid picks up more work, shifts a lot of work to the triceps as well, which it just becomes a limiting factor for a lot of people. That elbow flare out of the bottom of the bench press results in a lot of failed benches, even in higher level competition. So, the elbows do flare eventually, but I tell people to focus on keeping their elbows tucked for as long as they can. Just let the pecs do some work, again, let them do what they need to do. And then on the last portion of the lift, the elbows can flare, and when the triceps basically pick up a pretty mechanically advantageous position to assist in the lockout of that lift. So, again, recapping, bar should come down at a slight angle and ultimately should come up at a similar angle. But if we flare too early, we risk putting ourselves in poor position. We want to flare towards the end, which is basically necessitated when we lock out, right? The triceps end up having to take up some work no matter what. Overall, when I'm describing the up portion of the lift, it can be described as up and back. And if you've ever been to a competition of any kind or heard me coach, that's a cue you hear a lot, up and back on the bench press. Alright, the last variable we can manipulate is basically the incline of the bench press. Usually I like to make sure all the up boxes are ticked before manipulating incline. I'll give a little personal story here as far as like the efficacy of the incline goes for shoulder injury. In 2019 I sustained a pretty significant chronic shoulder injury from a competition, and I couldn't bench press, flat bench press without 6 out of 7 pain. And that continued for a couple months before I got pinned with like a relatively low percent. And I, again, figured, all right, I gotta fix something, right? And I manipulated all the other variables. So I started benching an incline. Now what was originally 6, 7 out of 10 pain was virtually non-existent in the incline. So that led me to this past year, the last competition I did. I pretty much got exclusively all my bench volume from Incline, and basically just did singles on flat bench. Singles resulted in very minimal pain regardless of load, and again, pretty much 90-95% of all my bench volume came from Incline bench press. So that should be taken with a grain of salt. It's likely very specific to the individual and the injury sustained, but it's a great one to manipulate the ball if you've been ticking all the other boxes, adjusting touch point, grip width, again, bar path, all that good stuff. It's a great one to manipulate. And when we're talking about finding pain-free movement, especially if you're dealing with an injury or trying to tackle the cause of the injury, being able to still train your press and still get bench volume, especially if like you're a competitive lifter, is like super important. So Incline, great one to throw in there, try if you're looking for pain-free movements to work on while basically fixing the injury itself. All right, to summarize, we've talked about 5 different variables we can manipulate to try to affect change in the bench press as far as pain in the shoulder joint is concerned. Grip width, where your hands are located out on the bar. Touch point, where you're touching on your body. Bar path, how the bar is moving. Scapular position, elevation, protraction, retraction, and then adjusting the incline on the bench press. So again, keeping this all in perspective, these are all good tools that will allow you to manipulate some basically the mechanics of the bench press while you should be trying to address the underlying issue of why it's hurt, right? Which we will have, which is a video for another time. All right. So thank you all for watching, and happy pressing.